In about 1897, a remarkable drop in the death rate among black people in Raleigh, North Carolina, was due to Dr. Lawson Scruggs. For the next 3 years, the community's average mortality rate was over 30% lower than the previous 10 years. Approximately 40 years earlier, he was born in a small town in Virginia in the world of slavery. In his medical school graduation speech, Dr. Scruggs set forth his vision: health and well-being for millions of black people around the world. I'm an emergency physician, so I have a front row seat to the amazing successes and the frustrating, heartbreaking shortcomings of our health system every day. I've spent the last 15 years studying how complex health systems function, and more recently I've been researching and writing about the extraordinary life of Dr. Lawson Scruggs. Dr. Scruggs demonstrated that the key to creating an ideal health system is to maintain a continuous emphasis on what we want the most. Optimal health and well-being for all at the lowest cost. That seems so obvious, doesn't it? That we should just keep our eye fixed on what we want the most. And yet, optimal health is so infrequently the main focus of our activities and our system. Today, with the internet, artificial intelligence, our scientific knowledge base, and the sheer number of people committed to health, the possibilities are endless. But we need to rid ourselves of decades-old assumptions and established ways of doing things that get in the way of what we want the most. And this is where Dr. Scruggs just might have one important advantage over us today. You see, he wasn't constrained by the assumptions that we have today about what a health system should look like. He was perhaps more free to imagine an ideal system. Here are the 3 lessons that I learned from Dr. Scruggs' persistent commitment to the health of his community. First, the healthcare system is only a small part of the health system. After graduation, Dr. Scruggs began a successful medical career, but he soon realized that social injustices were negatively impacting his patients in ways that he couldn't address in his clinic. This led him to become deeply involved in politics and writing, where he advocated for racial unity and women's empowerment. The second lesson that I learned from Dr. Scruggs is that health is a journey that we travel on with many others, not only an episode of medical care. Dr. Scruggs championed the idea that a physician ought to mingle with his community in their homes, churches, and schools. For him, an ideal physician regards the destiny of his patients as his own. Social relationships in our communities matter for health. Did you know that a lack of close relationships increases our risk of dying prematurely at a level similar to smoking 15 cigarettes a day? In our health system today, physicians like myself are rewarded based on the number of patients that we see, not the overall health of our communities. And this brings me to the third lesson that we can learn from Dr. Scruggs. Change the rules of the game. For him, the health system was an adaptive entity created to improve the health of all people. Yet many of his contemporaries quickly realized that by focusing the majority of their efforts on heroic treatments for the most privileged in society, the health system could be an avenue for great wealth and prestige, even if the system as a whole and those that needed it most suffered. Dr. Scruggs, on the other hand, rapidly adapted. He changed illogical and unjust rules that got in the way of the health of black people. When white physicians refused him the opportunity to join their medical society, he and his colleagues started a new one for black physicians. When he saw that many of his physicians were suffering from tuberculosis, he founded a new hospital. He advocated for church ministers to perform health functions, and get ready for this, women to be physicians. Now, surprising. A relentless focus means much more than simply mentioning optimal health in a mission statement or occasional mentions of the term in speeches. It's about ensuring that every clinical encounter, every hiring decision, every policy, every educational program, and every research question gets us one step closer to that goal. Dr. Scruggs was both visionary and successful, but here's the catch. He couldn't do it all on his own. In fact, while the historical record is limited, the reduction in death rates in Raleigh might have been due in large part to him simply opening the door for a group of black women. Dr. Scruggs was the primary physician at one of the only hospitals for black people in the South called St. Agnes. The head nurse at the hospital's nursing school, Marie Burgess, led her students into the surrounding neighborhood to visit poor and sick people in their homes. They walked for miles. They brought them food, eggs and soup and firewood and clothes. They developed relationships with the people and celebrated and mourned their life's events with them. This led to increased trust and confidence. They also taught the people about healthy lifestyles, such as improving the ventilation in their homes. The visits of Nurse Burgess and her students correlated with the decline in death rates. It's hard to imagine what our health system would look like today if that model of community health had grown and flourished across the nation in the ensuing 125 years. As the decades passed, however, the public understandably placed a high emphasis on urgent treatment for debilitating and painful conditions. Patients with broken bones, appendicitis, pneumonia, heart attacks, and other ailments arrived in clinics and hospitals, and the medical professionals that cared for them saved countless lives and avoided a tremendous amount of suffering. However, optimal community health and well-being for all at the lowest possible cost took a back seat. And that's because many capitalized on this rising need for urgent medical care. And our fee-for-service payment structure incentivized fragmented and inequitable care. And so over time, a new status quo solidified, with urgent treatment, prestige, and profits as major drivers in the health system. Tragically, the experience of Dr. Lawson Scruggs and Nurse Marie Burgess faded into the historical background. Here we are today with a health industry worth trillions of dollars, yet we have a system that no one would design. After all, we spend about twice what other developed countries do for health, though our life expectancy is 2 to 5 years less. Black Americans live about 5 years fewer than white Americans do. Health medical issues contributed to 2/3 of bankruptcies. In 2021, over half of U.S. physicians experienced burnout. And I could go on and on. We have so much untapped potential. Don't get me wrong. My colleagues in the health system are some of the most brilliant, caring, and competent people that I know. And there's nowhere in the world that I would rather receive urgent medical care. There are thousands of individuals and organizations across our country striving every day to optimize the health of their communities within the current flawed system. They're in your towns, and many are my colleagues and friends. In Drew, Mississippi, a town of just over 2,000 people, a grassroots group called the Drew Collaborative is engaged in activities to improve the well-being of their community, such as replacing dilapidated buildings with affordable housing, an important determinant of health. In Montgomery County, Maryland, the Primary Care Coalition is coordinating efforts between hospitals, county agencies, and community organizations for better health. Here in Utah, Intermountain Health and other organizations are advancing a vision of health, not just health care. In Palm Beach County, Florida, people with lived experience sit right next to clinical professionals to plan and implement programs to improve well-being and mental health. But all of these champions and many, many more are held back by the culture and system that we all inherited and that we too often contribute to. Now, there's no blueprint for creating an ideal health system, no guaranteed detailed plan moving forward, no elected official and no administrator alone is going to save us. We all need to step up. Who are the Lawson Scruggses and Marie Burgesses in your community today? Find them, listen to them, elevate them to positions of lasting leadership and influence. Are you a healthcare provider like me? Start by asking yourself, how would an ideal health system function for your dear family member? And then take one step in creating that system for your patients. If you develop policies, incentivize long-term health and well-being more, not primarily episodes of treatment. Perhaps you're an organizational leader. Identify and reward those with the courage and vision to transform the system, not just thrive in it. And then hire more of them. Now, of course, you should concern yourself with profits and metrics and licensing requirements and tenure and patient volumes. Just don't let those considerations overshadow what we all want the most. Are you a concerned citizen? Start with where you are and what you know. Maybe your parents are aging. Perhaps your neighbor is experiencing mental illness. Consider how an ideal health system could function for them. Then learn. Start a conversation, listen, and act, even if it's just one small effort. I understand that the very thought of transforming our health system can feel overwhelming. Do you feel like there's nothing that you, just one person, can do? All right, then invite your neighbor on a walk and ask her about her experience with health. Every social connection, every physical activity, every discussion matters. A relentless focus on optimal community health and well-being for all at the lowest possible cost by a critical mass of people will result in a health system vastly different than anything we know and unmatched in human history. During this talk, you may have thought of something that you can do to move us one small step closer to that goal. Do it. Today. Then tomorrow, do it again. Let's continue what Dr. Lawson Scruggs and Nurse Marie Burgess started. Thank you.